A very good evening, everyone. My name is Payal, and I welcome you all to We Talk Do You, a show by Puberty to Menopause, an initiative by Human Biologicals Institute. Human Biologicals Institute is a division of Indian Immunologicals Limited, IIL, which was established in the year 1982. And it's a wholly owned subsidiary of National Dairy Development Board, NDDB. Human Biological Institute, HBI, was established in the year 1998 when the government of India requested IIL to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of HBI was established at Ooty. The facility is one of its kind in India to have rolled out first Vero cell culture rabies vaccine in the year 2000. Subsequently, HBI launched other vaccines, and currently we are the major player in human vaccines and leader in ARV segment, anti-rabies vaccine, and present in around 50 countries. We have 3 state-of-the-art manufacturing facilities at Ooty, Gachibowli, and Karkapatla, also known as Genome Valley. Human Biological Institute has also forayed into the market of clinically proven wellness products and infertility range of hormones. Our vision is to shape global healthcare by spearheading the One Health initiative, and we innovate and produce and market quality healthcare products and services to improve and extend life. We believe in providing affordable products with high quality through continuous technical innovations and improvements to meet our customers' need. Well, before we begin our today's session, let me thank all of you to join us live today when we discuss a very interesting topic. June 28th, Father's Day, a day celebrated all across. You know, the special bond of a father and child is celebrated all across. To many, this day can be very joyful, but to some, it can be very difficult. With all the advertisements on TV, the posts on social media can be a little challenging to those who are struggling with infertility. And it's impossible to not feel left out in the cold. Well, you all should know that 1 in 6 couples in India currently are struggling with infertility and are having problem in conceiving. Well, in this infertility equation, men are half of the fertility equation. They're as likely as to suffer with fertility problems as women do. Well, today, to address the special issue of male infertility on a very special occasion of Father's Day, we have a very renowned infertility specialist of our country. Please welcome Dr. K.D. Nair from Delhi. Dr. K.D. Nair, currently Head of Department and Chief Consultant in Akanksha IVF Center, New Delhi. He is currently President-elect of Indian Fertility Society and has been Chairman, Infertility Committee, AOGD, and also Treasurer for LOC IFFS World Congress India in the year 2016. He has been Course Director in FOXY Certified Infertility Trainings since 2014, and basic and advanced for infertility training and IUI. He has been supervisor for 1 year fellowship in clinical ART since 2015 in IFS accredited centers, and 1 year fellowship in clinical embryology, IFS accredited center. He has also been esteemed reviewer in ASRM abstract since the year 2016 and has multiple international presentations in ASRM annual meetings and ESHRE annual meetings. It's a great honor and pleasure to have you, Dr. K.D. Nair, with us today. Thank you so much, Dr. Nair, for joining.
Thank you, Payal. It's my pleasure to be with you.
Thank you so much. So, Dr. Nair, before we begin today's discussion, can we please make a small request to the audience who is watching us today? Please put your questions in the comment section. Dr. Nair will try his best to answer all your queries till the end of the session today. But be a little specific when you're writing your questions, like your age, any specific condition that you're aware of, or if you're in between a fertility journey, please do mention all that. So it will help Dr. Nair to answer them as appropriately as possible. So with this, Dr. Nair, with your permission, can you please start, sir?
Yeah, go ahead.
Yeah. As we all know, sir, even now, infertility is considered or is still branded as a women's issue. But as we all know that male are an equal factor of this fertility equation. So with this, Dr. Nair, it will be really a pleasure to know from you what exactly is male infertility, and if you can help us to know the basic scenario. Over to you, Dr. Nair.
You see, you had given in the introduction itself, 1 in 6 couple is suffering from infertility. That amounts to almost 15% of the young couple having infertility. And when any couple comes for infertility investigation, we always start with investigation of the wife and husband at the same time. Husbands are responsible for almost 30% of the infertility problem as such, and in another 20%, they are responsible with the wife and husband together, they are responsible for infertility. So nearly 50% of the patients, the husband is the factor responsible for infertility. And when we say husband is 50% responsible, how the husbands are responsible? Basically, there has to be sperm production, number one. The sperm has to be transported in the semen, and the semen must contain enough number of sperms, and those sperm must be functional and motile. So this is how the basics of male infertility works. There has to be sperm production, and these sperms has to be transported. Now, when we look at the sperm production, everything is controlled from the mind, the brain. The hormones are produced from the brain, which act on the testes to produce the sperm in the testes. FHS and LH is released from the pituitary. It acts on the testicular cells, the Sertoli cells and Leydig cells produce the sperm production there. And these sperms are being transported via vas. They go through the passage, and finally we are basically ejaculated, and the semen is ejaculated. This is how the things work. Now there can be a fault at any of the point. There can be fault at the brain, there can be fault at the testes, there can be fault in the passage, the vas and this thing, or there can be fault at the penis also. There can be a erectile dysfunction, coital dysfunction, all those things. So this is how we have to investigate the male. Whenever a male come to us for investigation, we start with basic, the history, the physical examination, the semen analysis, hormone analysis if needed, and there are some specific genetic tests. If in some cases it has to be needed, imaging studies like scrotal ultrasound or TRUST whenever it is needed. So this is how we move around when we want to investigate what is the problem with the male. To begin with, the very simple, the history, we check for the infertility history, whether the husband has been married earlier, whether the husband has had fathered a child earlier on with another woman, and with this particular wife, is she not conceiving? What about his history of smoking, alcohol, history of wearing tight underwear, whatever increases this temperature of the testes? All these things you have to ask from the history, and similarly the history of exposure to gonadotoxic pesticides, history of having repeated chest infection. All these things we have to check from the history, and history can lead us many times to what is the cause of infertility in that male person. And then accordingly, we go ahead to settle this problem and to go further, how to evaluate further. Like I mentioned, first is the history, then is the physical examination, which may include the examination of the testes, of this penis, and sometimes digital PR examination. Then we may need to do a hormonal evaluation in certain cases when the semen count is less than 10 million per ml. We need to do a hormonal evaluation. Basically, like I mentioned, you have to have a semen analysis, which is the cornerstone of male fertility. This semen analysis we do with a very simple test and gives us a lot of information. And for the information of the audience, the semen count has been decreasing over the years. When I was medical student in 91 to 1980, that time when I was MBBS student, we were taught that the semen count was 60 to 120 million per ml. And slowly, slowly it has come down to 40 million. Then it came down to 20 million. Now currently the WHO criteria for normal semen count is 15 million. So it is a gradual decrease in the semen parameter, the semen count, and even semen motility has also decreased over the years. And I think it is the lifestyle changes which is responsible for all this. In the time of my father, the average semen count was 60 to 80 million. During my time, it has come down to 40 million, my age. During the age of my son, now it has come down to 15, 20 million. So this is a gradual decrease. And maybe if the decrease continue like this in future, maybe down the line after 20 years, 40 years, we may be having a severe oligospermia with men with having only 5 million count and everybody running to freeze this sperm for future use. In fact, many of the people in Europe, many of the families had already started freezing sperms for their future because they don't know what is going to happen 50 years from now or 100 years from now. Men will be having very few sperms. Then from where they will get progeny. So they have freezing sperms, you see. That is something probably it will come up in India also. That large families, they will like to have their own progeny in future. And
Correct. So, thank you so much, Dr. Nair, for giving us such a wonderful brief of today's discussion that you're going to have and giving us a basic scenario about male infertility. Now, you have, as you've already mentioned, that as the sperm count in male is gradually decreasing generation after generation. So, and you also mentioned a bit about the probable causes for this. Can you please help us highlighting more specifically what you mean by the probable causes of this declining sperm count?
lifestyle changes. It is the stress in the life overall. It is physical stress, mental stress.
Sir, can you please
It
a
is
little louder?
physical stress or it is a mental stress, and there is a smoking, alcohol, the anabolic steroids which are available with the gyms, tight underwear which increases the temperature of testes, and many of the younger generation are on food supplement. The supplement they are being advised to. So we don't know what all are there. And you see, there was a beautiful film I saw a few years back. I saw this film on BBC. They had found out that in a river in England, the population of fish in a certain stream of the river had decreased. They wanted to check what is the issue. They found out that one of the pollutant from the factory which is pouring in that river, and following this discharge from the factory, down the line the fish population has decreased. They found out, they analyzed what the factory is producing. The factory was producing basically a material which is used for making our plastic water bottle. The compound which is being used to make the plastic bottle has lot of estrogenic properties. So when the fish is drinking, swimming, living in the water with estrogenic properties, the male fish produce their sperm production decreased, so they were not able to propagate further. And that is how they found out that the plastic bottle which is being used for our water, it has
Yeah.
estrogenic properties, and it can have effect on the sperm production by the male. So if you go now, I've been visiting Europe since many years. Currently, if you go to Europe, you'll find everybody giving you a small glass bottle to have a glass of water or even beer, only in glass bottle. They are no more running and using this plastic bottle, which we are still using in India. We are running only after the plastic bottle. We think that in my own house, my refrigerator, the water is kept only in the glass bottle. We don't use plastic bottle.
Great.
So this is how the things can evolve over a period of time. That if you get more exposed to estrogenic properties, your sperm count is going to be decreasing. So that is how
Thank
it
you.
works.
Thank you so much, Dr. Nair, for giving us such a wonderful example of the movie that you saw. And yes, and definitely a very good takeaway from this statement that Dr. Nair has given, that we need to stop using plastic bottles, and it's always better to to stop using plastic. Now coming to the next one. No, it is believed that men's age is not a factor of concern, unlike women, when it comes to the fertility equation. And infertility, as infertility is always understood as a silent thing until and unless a couple is trying to conceive. But can you help us? Can you help our audience to know more about, like, are there any signs, or I would kind of symptoms, or that a man should know, and he should be concerned, that he should think about his fertility factor. Are there any kind of signs that they can look out for?
Let me be very clear. The biological clock is tickling both for male and female. It is not
Okay.
only tickling for females, it is tickling for males also. Generally speaking, we find that a man who is older than 45 to 50 years, the sperm count, the sperm morphology, the characters of the sperm, they change. The anybody who is more than 50, and if you father a child, there are
So can we be a little louder, please?
any male who is more than 50 years, if he father a
Yeah.
child, there are more likely to be more incidences of genetic abnormality in the baby.
Okay.
It is very clear to us. A older male also has a problem, and once you get older, you develop other medical issues. You develop diabetes, you develop hypertension. You have to take medicine for all these things, and all these affect your sperm characters, sperm parameters. So it is very clear. So male, all males should try to finish their pregnancies, achieving pregnancy definitely by 40 years, not to postpone such. We have seen many news time. We have seen in the newspaper many time. There's somebody who is 70-year-old has fathered a child. Yeah, it comes. You see, it does come that even at 75, somebody can father a child, but that is not the routine. The routine is you should finish your fathering a baby definitely by 40, 45, not later than that. Because after that, you are going to develop more problem with the baby. You are going to have more medical issues with yourself. So that is very clear. You cannot postpone it. The biological clock is both for females and both for men.
And the next one would be like any specific signs or a man of during his 30s or 40s can know or can understand that he should be concerned about his fertility?
You
Are
see,
there any such?
like you see, these days because of this Google and everything, people have become more and more intelligent, more and more aware. Like today only, I had a young man around 25 years walking into calling me and then walking in that he want to have a semen analysis. I said, what is the problem? Are you married? He said, no, I'm not married. I'm planning to get married, but I want to check what is the status of my semen parameters. I said, okay, fine, we will do the test. He went and did the semen analysis. But what I'm saying is now people have become more aware. They have become more aware. So they have become more aware of what is the semen count, what is semen mortality, sperm mortality. So all these things which were technical things in the past is now no more a technical thing. It is available on the net. The people can have a look at that. What is the current status of the semen of a particular man, and is there any other associated medical problem? You see, this premature this premature ejaculation is a big market, big pharmaceutical market in India, more than 90 crores. There are various drugs being marketed to improve this problem in the man, premature ejaculation, premature this thing. And if a man is having this sort of a problem, he's always more worried that what is going to happen to his fertility in future. So people are now aware. People are now aware that their things can, if the things are normal or things are heavier, they can try and see consultation. That is happening. That is happening now.
Great. Uh, thank you, sir, for answering that question of ours. Now, we would like to know more about. There are a lot of tests involved. You mentioned about a person coming and asking about a semen analysis. Can you help us understand our audience about what are the basics of tests that are involved and how do you actually diagnose in basic stepwise manner? And after that, we would also like to know the basic treatment options that are available for male infertility.
You see, basically, we have to do semen test. Semen test is the cornerstone of male fertility. And when before we do a semen test, we tell the husband, the man, to have an abstinence of 3 days. That is more than enough. He will come and produce a sample. We check for the total volume of the sperm, volume of the semen, the total sperm count, the motility, the sperm morphology. These are the various parameters which have been defined by WHO, and we analyze this sperm, semen as per these parameters, and then we tell whether sperm count, sperm, this particular sample is normal or it is oligospermic, or motility is less, or the morphology is less. We define according to this parameter. And once we have done a semen parameter and we find the semen count is less than 10 million, we will always like to have a repeat semen analysis. One semen analysis is not enough. You must have two semen analysis to label a particular sample as a poor sample. You cannot have only one semen sample. You must have two semen report with you. Only then you can say this semen is having a particular type of problem. And once the semen count is less than 10 million, or if there are some sexual disturbances in the male, we advise him to do a hormonal as evaluation. Hormonal evaluation is basically serum testosterone, total testosterone, and FHS. If the serum testosterone is less than 300 microgram, then we advise to do a free testosterone, LH, and prolactin. This is how we go about. After all this hormonal evaluation, we can make a specific diagnosis whether it is hypo, whether it is a normal male, or if there is hypergonadotropic male. And according to that, or once we do a semen analysis, when we find no sperms, causing many a time in 5% of the patient male, we find there are no sperm. Then we have to do imaging studies like scrotal ultrasound or a transrectal ultrasound to know what is the status. The scrotal ultrasound will give us information about testes, about varicocele. The transrectal will give us information about prostate, about vas, about epididymis. So all this investigation will help us in making a probable diagnosis what is the problem with the male. And in case many times we still don't find a particular situation to be very clear with all this investigation, then we have to do a testicular biopsy to know what is the problem. That is the final step, and we must do testicular biopsy in a setup where there are facilities for freezing the sperm. Supposing you find some sperm during the testicular biopsy, you should be able to freeze it at the same time, which can be used subsequently. You cannot keep on doing biopsy again and again to take off the sperm. No, you do only biopsy one time, and if you find sperm, you freeze it for future use. That is how we go about. So this is the evaluation plan for a male, generally speaking. Of course, there are other tests which can be sperm function tests, which are not done in all cases, only when it is needed. Generally, you know when you have to do this sperm function test and other specific tests.
Okay. So this was, thank you so much for letting us know the probable diagnostic test that needs to. After that, Dr. Nair, can you help us to know what are the probable treatment options? Like there are a lot of ART methods, and which are specifically, the acronyms that a couple hears to is IVF, IUI, ICSI. So, considering if a male infertility factor is associated for the couple, what are the probable treatment options that you go for?
You see, any male who comes to us when we are treating a male, first thing is to improve his lifestyle. Improve his lifestyle. The male should be encouraged to have a good nutritious diet, with proteins, and should be able to have a regular exercise module, and to avoid stop smoking, alcohol, no underwear, no very tight underwear. Basically, he is encouraged to have a good, healthy lifestyle. That is number one, which will encourage a sperm production to happen. Then there are option of a medical treatment or a surgical treatment or an ART procedure, like what you mentioned. Medical treatment we can have in cases of hypogonadotropic hypogonadism, when the hormonal level produced by brain are low. In those cases, we give SCG and FHS injection from outside. This procedure, this treatment continues for 6 to 9 months, and we may find that the sperm production can happen in such a patient in course of time. The other is in cases of obese patient, when the males are obese, the testosterone estrogen ratio is decreased less than 10. In such cases, we have to give them letrozole to stimulate the sperm production. In cases of idiopathic male infertility, there are a lot of empiric treatment available in the market, but most of them generally are ineffective. So we have to
Okay.
talk to the such patient that you are idiopathic male infertility. You may take this empirical treatment. We may give him lot of antioxidant which are available in the market. Antioxidant is a huge market in India, and one tablet, one treatment per day is almost 60 to 100 rupees per day. So a male has to spend a lot of money for this so-called empiric treatment. Whether it will help her or not, we don't know. Although a Cochrane study published in 2014 indicated that when you take this antioxidant, it is supposed to have a improved live birth rate and pregnancy rate in some patients. So that is what we are also prescribing in our clinic to a lot of every female who having idiopathic male infertility take antioxidant. That is number one. If after all this thing we find the sperm count, according to the sperm count, we advise the ART treatment. If the sperm count is 15 million or anything more than 15 million or more, we will advise them to have a natural contact and program natural contact. We follow the wife, follow the follicle. Once the follicle is ready, we tell them to have contact on particular days. And if this thing doesn't work out, we will advise them to have IUI. But for IUI, the patient must have 5 million motile sperm in a semen. Only then the IUI is advised. Although when patient with a lower sperm count are also there, who cannot afford the next step IVF or ICSI, then we tell the patient, we explain to the patient, okay, if you cannot afford, well, let us continue with IUI. IUI is a very simple procedure. The husband will give us a semen sample. We will wash it as per the protocol and remove the debris, remove the dead sperm, and we inject this sperm directly into the uterus. This is IUI. Next is IVF or IVF. We will stimulate the wife, produce the eggs, take out the eggs, keep it in a dish, and take husband's sperm and wash it, put a drop of sperm with the egg. One drop of sperm has almost 50,000 sperms. Out of 50,000 sperm, one sperm will enter the egg and fertilize it. This is IVF. When the sperm count is very poor, less than 2 million, we do ICSI. In ICSI, what we do, we wash the sperm, catch hold of a single sperm, motile sperm under microscope, and inject it into the egg directly. This is intracytoplasmic sperm injection. This is available to us. We have many methods available to us these days, how to separate the sperm, how to wash the sperm. We have many methods available to have sperm with less DNA fragmentation, and all these facilities are available with us. We are using it in our center also. This new technique for microfluidic is there, which give us sperm with the very low sperm DNA fragmentation. So we are using it. So even if if a male has different type of issues with his semen parameters, we can solve it. It is no more dead end. We can solve it. Whether the count is very poor, if the sperm morphology is poor, the sperm DNA fragmentation is high, we can tackle it.
Great. Definitely. So, because the current advancement in medical sciences, I'm sure it has been very helpful to millions who have been trying to conceive, and that is definitely a boon. Thank you so much for explaining the treatment options so easily. I'm sure we are having a lot of audience who are joining us and watching our video right now. Thank you everyone for joining We Talk Do You show by P2M, initiated by Human Biological Institute. Though for those who have joined, I would request please put your questions. The session is still on, and we have more interesting discussion coming up with Dr. Nair. Sir, before we move on to take up the questions from our audience, we would like to ask another major query that is currently streaming up. That is, as far as the COVID-19 situation is concerned, as of now, what is your suggestion to the couples or specifically males? I mean, what should be their the decision, like with the vaccinations coming up, and again those who were in between the cycles or those who are trying to come out and meet an infertility specialist when they're trying to conceive. What is your suggestions to them?
You see, about the COVID, there have been a lot of discussion since last year when COVID thing came up. Once it came up last year in the month of January or so, we were not knowing how it is going to affect us, affect the males or affect the females. In course of time, we understood the disease, understood the effect, and the many guidelines have been there, which have been which are getting updated repeatedly. Right now, what we are saying is, if a male is infected with COVID, has developed COVID infection, he should at least take a break of almost 3 months before
Okay.
in a pregnancy. You see, this was 1 month initially, then reports came 2 months. Now, most of the centers they are advising that if a male is has a COVID infection, he should wait for at least 3 months before attempting a pregnancy. As far as vaccination goes, there is no problem. You can have a vaccination, and if you don't have any side effect from the vaccination within 1 week, you can go ahead for your fertility treatment. You don't have to wait. But the problem was that if a male has COVID infection, they have found out now that you can have COVID virus even in the sperm, semen also. It has been discovered in the semen also. Whether it is causing any effect on the baby conceived, we don't know. But it has been found that it can be there in the semen, in the testicular tissue also. When these patient went for treatment, they have found out the virus in the testicular tissue also. So this COVID virus can be anywhere in the body, you see. So best thing is if a male has had a COVID infection, take a break for 2 to 3 months before attempting a pregnancy, so that the things are totally cleared out of the body. And vaccination, go ahead. There is no issue. The vaccination, just a rest for 1 week or so, that is more than enough, and patient can continue the fertility. And you see, there are very clear-cut guidelines about the COVID infection during treatment, when you're giving treatment or before treatment, what the patient has to undergo. They are very clear-cut guidelines. All the patient has to undergo a triage. All the patient has to have a negative RT-PCR here in the beginning of the treatment, and also negative RT-PCR just before ovum pickup. So you have to follow this guideline, which have been very well established. So you cannot say you are not aware. You have to be there.
Thank you so much, Dr. Nair, for answering those questions of ours. I'm sure everybody watching this video today would have benefited from this. It's a request to all watching this video. If you think this will be helpful to your family, friends, or someone who's in need, please do like and share this video with them. Now, with your permission, Dr. Nair, can we take a few questions from the comment section, please?
Yeah.
Yeah. So we have a lot of questions coming up, sir. Okay, the first question, I think Dr. Nair has already informed that somebody is asking, considering the current lifestyle, up to how many years a male remain fertile?
Male can remain fertile till male dies. But the issue is, anybody with more than 50 years, the sperm parameter will change. Sperm count, sperm motility, sperm morphology, everything will change. So you have to be careful. There are more chances of sperm DNA fragmentation happening in an older male. So the chances of producing an abnormal baby are higher when the age of the male increases. Same if the age of female increases, same with the age of male.
There's one more question that one of my cousin was treated for cancer. Now, after 5 years, they are planning for kids since 2 years. His age is 33 years. How does this impact him for having kids?
It doesn't impact. You see, it all depends if he had a cancer, and before taking treatment for cancer, he had kept his semen frozen. That is what most of the people are doing now. Anybody is going for cancer treatment, the cancer specialist tell him go to an IVF center, go and freeze your sperm before starting treatment, before starting chemotherapy or radiotherapy. They will freeze your sperm, and sperm can be frozen easily for years in this thing. Once they are through with their cancer treatment and they are free of cancer, say 5 years down the line, they can use their frozen sperms for achieving further family They can increase the family. So that is the one. Have we have to be aware before taking cancer treatment that they should be able to fuse the sperm. Similarly, for the female, they are supposed to fuse the eggs also.
Right.
This is what we're doing.
Great, sir. Now, sir, can the prolonged use of steroids cause male infertility?
Yeah, definitely. This use of anabolic steroid, testosterone, all the derivatives, they will decrease the sperm count. They will totally decrease the sperm count. And most of the people are prescribing this testosterone for the building of the muscle. You see, six pack and all those things. But in the process of making six pack, the sperm count become hopeless. That is the issue. So one has to be very careful. If we get young boys who get married and come back with infertility when we do a semen analysis, zero sperm count.
Right. Now, sir, can carrying a laptop on the lap for a longer time due to work can affect fertility?
We always tell the males that don't put your laptop on the lap, put it on the table. And then you can use it for as long as you want. When you put your laptop on your lap, the heat and radiation is getting down to your testes, you see. And why to expose testes to a higher temperature, a radiation element? Why? So better to put it on a table top than use it.
Correct. We'll take up this last question, sir. Does immunity have an impact on fertility? I think they want to ask whether the vaccine-induced immunity for COVID vaccine can affect fertility.
Generally speaking, I say most of the reports will come that you can take the vaccine. There is no problem with your fertility. You can take the vaccine, and if there are no side effects from the vaccine in next 1 week, no temperature, nothing, you can continue with your fertility program. But there is no need. There is no problem. So vaccine will not affect your either the male sperm count or sperm motility or no. Vaccine will not affect. Similarly, vaccine will not affect the female also.
So thank you so much, Dr. for answering that. I think that was the most running around myth all across. So guys, please do take your vaccinations if you are getting your slots. It will not affect your fertility. That's a complete myth, as Dr. Nair has also confirmed. So with this, Dr. Nair, I think we have taken the questions. We still have a lot of questions in the comment section. We would like to, some of them have already been discussed during Dr. Nair's session. He has already discussed during his talk. If you have any more questions, you can still write to us, and you can visit our www.pubertytomenopause.com for more information. With this, I would sincerely like to thank Dr. K.D. Nair for your time, sir. Thank you so much for joining us today and addressing such an important topic. Male infertility and Father's Day coming up day after tomorrow. I'm sure it would have given a lot of hope to many who will be watching our video today. Thank you so much, Dr. Nair.
Thank you, Payal. It has been my prayer talking to you. And as you mentioned that 20th is a Father's Day, I've already started receiving greetings from my grandchildren.
Great. We would also like to wish you a very happy Father's Day, Dr. Nair, and actually want to thank you from entire team, Puberty to Menopause, an initiative by Human Biological Institute, and actually want to thank you for giving hopes and turning their hopes into reality and making many dreams come true. Thank you so much for that. Thank you. Now, coming to our audience who have been with us, who have tuned in with us today, thank you so much for watching our video. We would sincerely like to request all of you that, as Dr. Nair said, vaccination does not affect fertility. So please do take your vaccinations once you get your slots, and keep your masks on, maintain social distancing when you're out, and keep regularly washing your hands. With this, we definitely will, as as a team, you would definitely come out of this situation of COVID really soon. Thank you so much for joining us today, and please like and share Puberty to Menopause Facebook page for more information, and keep and be with us till we come up with the next show of We Talk Do You with another interesting topic. So thank you so much. Have a great evening, everyone, and thank you, Dr. Nair. Have a great evening, sir. Thank you.